is that you still stay in the medical school. So, 5-year medical school, then you have 3 years master degree, 3 years PhD, here, there, and stay in medical school for 11 years. But then, until later, when you really start to practice, you truly feel a little bit more confident. With more education, more work, more research done, you feel truly more benefit. But since I came here, practice medicine here almost 20 years. I've practiced Chinese medicine in Beijing 10 years. Really, really old doctor. So many, always to teach with my student. I said, the student also will ask me, I need so thin, we already drop. I said, when you hold longer, like for me, like a chopstick. So you feel that, you feel definitely different. So today, so happy you guys are here. So what I really want to do, let people know is how we really can do from the Chinese medicine way for the cancer patients. So in the Chinese medicine, they recognized cancer long time ago. Actually, really, we use cancer, this disease, can be up to Song Dynasty, which means 800, 900 years ago, long time. That's so they know there's a disease, especially recognized like breast cancer, much early. So you use their old traditional way, no chemo, no radiation. They still also do some surgery, the old type surgery. All their way, they said they can save 30 to 40%, can be cured without chemo, without radiation, all that. That's quite a high rate, right? Mm-hmm. So what do they really do? They use herbal medicine, use acupuncture, herbal paste. Certain cases, they do recommend the surgery, but most times they don't like. That's related to their older philosophies. So I do use that old technology. We have to combine with the modern science, right? That's why we call them integrative medicine. So basically, gradually form my opinions, my technique. For cancer patients, if we can diagnose early, that's the best way, just surgically. If we can surgery, especially patient is stronger, the body is good, before cancer really eats their energy away, surgery is definitely. Then certain cases for blood cancer, lymphoma, leukemia, this type chemotherapy really save life. So that's why I tell my patients, some of my patients go to me and say, Doctor, I don't want the chemotherapy. I said, if we want to survive, we have to adapt it. Like we have leukemia, multiple myeloma. The chemo really work. Only things we need to work together with the cancer oncologists is don't abuse that body, right? Don't overuse the chemotherapy too much. Just we work together with them. But for many solid cancer, like a patient cannot tolerate, then I tell them don't try it. This is not help. Your body cannot handle it. It's not help. More suffering while we do it. So that each individual case, we give a different treatment plans. That's why more personal. So basically, if surgical available, that's best. Certain chemo, like maximum 8 session chemo. That's why for some cancer I do recommend it. Just I don't like to abuse it. Okay? And now we go. That's why we do a little the cancer is still most difficult disease to be treated. But the difficulty is we cannot use one cancer diagnosis to cover the 200. There are more than 200 different cancers. So many cancers we're not afraid, like skin cancer, basal cell carcinoma, squamous carcinoma. We find early. Prostate cancer, find early. Breast cancer, stage 0, stage 1. We all can reach a cure, right? But there are so many. So we are always looking for, in the lab, we're looking for magic bullet. There are really not much magic bullet. Preventive and find early. Because there are so many, 200 cancers. We cannot use any one single regimen to cure them, right? So the really drive me very attention is we have more cancer patients. So our treatment improved. Many cancer patients survival rate also getting better. But the trouble is we never stop, never lower down the incidence. We have more and more new diagnoses every year. That's really the scare part. Almost like an average, like every 3 women in their lifetime will be 1 or 3 will have cancer. In men, even worse. Every other man, 1 or 2 will have cancer later in life. So that's why we really need more focus on how to prevent it. So that's also today's major topic. How do I prevent? Okay? We have no cancer, how can we do to make sure no more cancer? If we had cancer, how can we do make sure never relapse, the cancer never relapse? So that's more important. Here, we said approximately 10% the new breast cancer patients in a young woman, in the 50s or early 50s. That's crazy. I treat some cancer patients, the breast cancer, youngest is 25, 26. So I check their family genetic, hereditary or genetic factors. Actually, their family no breast cancer genes. Nobody carry that. I found that they've been on birth control pills for 15 years or 10 years, like 25 years old, since they're 15. That's definitely a negative factor. So overuse of hormones, overuse of drugs, that's really a problem for the young woman. So that's what we need to change. So that's interesting. What is really cancer? We know what's cancer, but a different aspect will give a different conception. I like the first, that's why I put in the first sentence. Cancer is a ticket to let you live behind your intolerable life. So actually it's God that help us, right? The issue with ticket is because you don't like your life. If you really enjoy life, we will not get this ticket. That's why the trick is if you really want God, withdraw the ticket, enjoy everything, right? Enjoy life. The life is still beautiful, right? That's truly, it makes sense. If you check with a lot of cancer patients, before they start to have cancer, they went through a horrible stress, right? Physical stress. Most, sometimes not, but most of them, the stress is a so negative factor. So that's cancer. For genetic scientists, this cancer is a product of a genetic mutation. But what causes genetic mutation? Can be so many factors, right? So many carcinogens. Stress is number 1. Then chemicals, like we mentioned hormonal therapy, the improper hormone treatment. So many factors, like infection, chronic infection, all can cause genetic mutation. The number 3, the cancer is from incapability of immune system. So our immune system, like our watchdog. That's why we said like an analogy. We have a watchdog in our home. If we treat it properly, they are alert. Any bad guy came in to fight for us, defense. If we treat them properly, or they either too hyper, like allergy condition, or either too lazy, they don't care what happens. That's also cancer starts. So we so much stress, so fast with small things, our watchdog definitely will not work properly, right? Then he can watch the bad guys? No. So then cancer will start. So that's also can be read. For the evolutionists, they said cancer is a fundamental consequence of the way we are made, which means no matter how long we live, there will always be an end, right? God will have a way to take us away. But what we need is we stay longer as we can and enjoy life longer we can. So if we want completely eradicate cancer, what we said is we need to make ourselves to reborn again in a different way. And that's a little negative, but teach us to be more peacefully. If we diagnose cancer, we can accept it then we find a good way to treat it. We don't need to be panic, right? There is a way we have to face life. But in Chinese medicine, what we really think is what cancer. We think the cancer is a phlegm, is mucus. You can think a little bit. When you had the cancer, before you had the cancer, always have a lot of mucus thick. So that's what we want. Mucus, where the mucus come from? From chronic inflammation. Chronic inflammation, there will be excretions. Excretion, that's a phlegm, that's a mucus, that's a saliva, a thick saliva. So if you have that expelled out, many people swallow it. No, wrong. Have to get out. So in Chinese medicine, where that cancer or mucus come from? The mucus come from? They think from kidney energy weak. Kidney energy in Chinese medicine is their vital energy, which means our bodies can moving because we have kidney energy, kidney push, power. When this energy is low, our body metabolism will be slowed down, water metabolism. Then the mucus, the water retention will focus on our middle part of the body. The middle part is the spleen stomach. That's why spleen stomach cannot digest well, then the mucus will be produced. After the mucus produced, where they stay? Stay in the lung. That's why the lung is a container in Chinese medicine, they think, this is their theory. So they produce by kidney, we manufacture by spleen, then still stay in the lung. So that's why how important to clean up, to keep our lung clean, get more oxygen. So then later we'll teach you how to keep your container clean, okay? So there is a little graphic. So that's what we discussed, how the mucus. Now here, in the beginning, that's a normal. I use the breast cancer that's a really clinical pathology field. That's a breast conduct, the duct. That's a normal. We can sell so equally the duct. The milk excretion will go in here. Yeah, it's very beautiful when you see the pathology slide. Then in the beginning, most cancer is like colon cancer, breast cancer. It started not right from a cancer. It slowly became cancer. Like if we stressed, like over-traumatized, it became like a mastitis. So in here we call it benign proliferatory change. That's like a chronic inflammation. Then we give a treatment, give a little clear heat medicine, anti-inflammation medicine. This will stop easily, no trouble. But if we neglect it, we still stressed by something else. We forgot, we neglect it. Then there will be we call them hyperplasia. The tissue start to change a little bit. The more this cell we call them lymph inside. More immune cell will go here. They're supposed to do good things, but they destroy so much cells, the tissues. Till here, that's already we call them ductal carcinoma in situ. You can see there the little tumor fill in the duct. This is still the early stage. Still we can easily do a little lumpectomy without the chemo, without radiation to clean them up. Till it became invasive, you can see the duct totally messed up. That will be difficult. That's why you can see gradually the mucus build up till the whole mess up. That's really a cancer. So if we can cooling down and take the mucus away, we can stop the inflammation in the very early stage. So we don't afraid of that. That's why we mentioned how important our mental issues. So when we relaxed, our nerve system can sense our body more. Like they can easily something wrong, like breast tendon, and then we go to check, or we take the medicine, or even my acupuncture treatment, directly in logo, open up, track more immune system, immune cells to kill the inflammation easily. But if we neglect it, or some patient just perfectly, he sensed that, he neglected. Until tumor so big, I said, how could you wait so long? That's not 1 day or 2 days. First, they neglect it. Second, they scared. They want to deny it. You give them a chance. So that God definitely will give you a ticket, right? So you can see that's why we can, just a moment, keeping yang qi deficiency, it's a source. You're too tired. You overstress. You make the yang qi weak. Then you abuse the body too much. Then you too stressed, make a liver energy stagnation. No body, the water retention cannot be transformed, cannot be moved. Then you can use too much sticky, we call the mucousy food. What worse is the sugar? That's what I learned in this country. I've been here 20 years, almost an old American. One day I went to a food festival. All the famous restaurants, chefs on there. I saw a dessert with a few pieces banana. They add some juicy liquid there. I take one, so tasteful. I wait in line to get another one. Tell me the finish. I watch the chef, perfect to cook it. He has one big bag sugar in the stand. Big bag. I'm not exactly, at least 50-pound bag. That's what his cooking pot. He dumped two full cup sugar on the pot. Then what he cooked for 4 serving. I was shocked. I said, as a very famous cook, the chef, I said, what did he do? He put so much sugar. He said, no, that's the recipe. I was really serious. That's why it's so tasteful. I walk away and my God, I already take a full half a cup of sugar. So these things make your pancreas overworked. And the cookie is very bad. I watch one gentleman every day take 2 big cookies. The triglyceride is so high, the kidney function going down. That's why we have this country have much more pancreas cancer than in the developed countries. I never see so many pancreas cancer cases. So that's why the sugar, that's really our bigger enemy. Also the oil. Oil is a very greasy food, right? So we call them mucus food. So what we do recommend is, like we said, olive oil is good. Yes, it's not good enough. If you take too much, it's bad. Coconut oil good, it's good. But this oil is, what I suggest is you mix up. Today you cook olive oil, tomorrow you use vegetable oil, right? Then you use peanut oil. Always alternate. That will be more balanced. One oil you eat too much, then you can change, and can accumulate. From short chain be long chain, not good. More balance, more variety, and less. Too much is too mucousy, like butter. If people cannot eat without butter, not good. Too much. If we eat it regularly, we'll be more balanced. So here I do a little, just put it together, a few famous, people who died of the cancer. You can surprisingly how young, but mostly handle traumatic stress. Let's say in the Chinese, this one young girl just died, 27 years old, just died of uterus cancer. In this country, you can see so good because pap smears save a lot of life. In China, pap smear is still not a routine, even now. This is a very famous new actress, have many famous films. This is very sad. Too late. And then you can see the actress' life in China is miserable, very stressful. This we know, Audrey Hepburn, right? She died at 64 with colon cancer. That's it. You can see this is one of the very famous anchor in China, died of lymphoma. From diagnosis to die, less 3 months. Traumatic stress he handled. It's very, very, in Chinese society, very famous. And this is 33, lymphoma. very famous actress. This is not an average person. For these people, they can access every money, every high quality doctor. They have a lot of money, much more than we can think. You can invite any good doctor to treat, but still not save their life. That's Mei Yanfang, who is Hong Kong's. We call them just like a giant, just like a huge star, superstar. 40 years old, uterus cancer, endometrial carcinoma. From the diagnosis to die, that's 2 years. That's a chemotherapy overuse.
Chemotherapy overuse.
Yeah, overuse. This is 34, breast cancer. Famous singer. This died just very lately, just 2-3 years. There's also for Han, very famous Chinese educator and also we call him opera singer for Han. 55, neuroendocrine cancer tumor. Supposed not died, but after surgery normally no relapse. Neuroendocrine, not like adenocarcinoma. That's easy. Actually, if we surgically successful, should survive. Too stressed, back to work stress, relapse, then no chance. 55, very young. This lady 40, breast cancer. That's Li Yuanyuan. It's a Chinese first rank actress. That's breast cancer. It's Feng Feifei. It's from Hong Kong. Died at 55, lymphoma. It's 25 years old, stomach cancer. Wu Jiadan, very smart. The people at the funeral, the whole nation was crying, the whole country. This we know Peter Jennings. I came to the country, we learn English. I love his broadcast. He speaks so good English, so good. But one day when I heard that he has lung cancer, oh God, I was so sad. He's a good smoker, very heavy smoker. Also his personality, very stressed personality. But a great guy.
Oh, yeah.
Jackie Kennedy. You can imagine how stressful her life, right? 65 lymphoma. It's a Power Roger. He had a student in China. I know him very well. He's a great opera singer. In China, he has a big name. 71, died of pancreatic cancer. Also lately. This we know. Steve Jobs. Look how handsome. I never thought, because when I know him, he's already slim. Yeah. But with the chemo, look how crazy he destroyed. He survived almost 9 years, but the treatment is still. That's what we found later. It's a wrong treatment he did. If we do early, like liver transplant or something, it would be different. Look how handsome he was. That's too much stress he handled. That's why one day I compared Steve Jobs with Bill Gates. You can see the Bill Gates, the personality totally was different with Steve Jobs. Steve Jobs more stressful. His life, you can see how stressful life he went through. He used to start with a partner, then he was kicked out so much with the family issues. Bill Gates much more happy family, happy careers. So you can see the stress impact to people. So here I collected two compare photos. So this is a very famous Chinese singer, Ye Fan. Just before he get chemotherapy. Look at how the chemotherapy did to her. After chemotherapy, she had no chance. They destroyed the beauty. She totally despondent. She had no desire to survive. 2 years later, with the chemo, she died. That's breast cancer. You see, this is very famous in China. Look how beautiful she was. That's in China. There's a we call it Red Building Dream. That's a classical Chinese literature book. She's the famous for the actress for that movie. That's the movie picture. So after chemo, even she totally turned herself, converted to a Buddhism. She died at 40. last 3 years old, the last 3 years with the breast cancer. She make a lot of money. She became a very big company chairman for advertisement. Till she realized the stress killed her, she put everything away. Too late. She go to the temple, that's what she went in the temple like a nun. Still too late. So we saw this. When I put all these pictures together, you can see all these people have one thing similar: stress. Stress, depression, that's a bigger killer. So that's why I named the carcinogen factors. The water is the most risk factor for cancer. Stress. Okay. So that's why we don't rush. Sometimes my patient late. Sometimes I'm late. I said, don't worry, I'm always late. To let you wait, I can wait, no problem. We know we don't need to be rushed, right? You came here, I said, you came to see me, not just for appointment. You actually spend almost 1 hour with me. So that's your life. Also my life. I spend this maybe 10 minutes, 20 minutes with you. So that's not just for appointment. So we from very beginning, each step. Now you come here for a lecture, you lost, drive around, see the beautiful scenery, too late. Just change the personality, okay? Then why we rush? No reason, right? So we see the bigger pictures. Now we don't need to be stressed, okay? Just for fun. So here I do a little bit little conclusion for what is really Chinese medicine. The Chinese medicine is a very old medical system. So this from like a diagnosis, from the symptom collection, like I read your pulse diagnosis, read your face, read your tongue, eye. What I want to collect the data to reach a diagnosis. So from the diagnosis till the treatment, till what the treatment plan, till what I give you treatment, they are very systematically. Normally, like an alternative medicine, we see the older folk medicine, they don't have that. They can have a very effective like a herbal formula, but the lack of a systematic theory. That's why Chinese medicine really can survive for so many years, because they are from the diagnosis, basic theory to diagnosis, to treatment, to give what the detailed modality they use. Beautiful. When you practice longer, you feel this so logic, so beautiful. So that's why what is the modality they have, like acupuncture. Acupuncture is a lot of patients ask me, how the acupuncture works. Acupuncture, we use a very fine needle, choose certain point, we insert the point, just needle in. That's just the basic. If you want to be really do something with patients, you need to move the needles. Yeah, someone you don't like it, but put it in, that's easy. But give patients precise signal, that's the technique. But generally, like an acupuncture practitioner, you need to do 3 signals. One is like I give this point, a patient have hypertension, their liver fire too much, I need to tranquilize them. So I have to generate a signal to tranquilize. We call them reducing, push fire down. Or if the diarrhea, the spleen no energy, I need to lift the energy to hold the bowel. So I need to give a signal to lift them up. Also, this point they're doing good, this meridian is a good job. I want to give the notice, like oh, you guys do a good job, but I still want to let you know as a neutral signal. That's at least the 3 basic you need to know. So with this physical stimulation, will be translated to a from physical stimulation to a chemical signal. That's how they work. We know that herbal medicine, chemical pills, that's a chemical to chemical, right? This difference is a physical stimulation to chemical reactions. You can see it's more precise. We need to use our body. If our body is so weak, so collapsed, so imbalanced, the needle really don't do too much. In that moment, we need to give you some herbs, some other treatment to build it up first. So that's why all can be. That's why needle is more quicker. When pressure longer times, we know that herbs go in, stomach, go liver, go blood, and go to target. Take a much longer time. Needle really faster. There's an acupuncture, but you have different ways. Like we're getting older, we're more proud of your technique, needling, right? When younger, we like using electroacupuncture. So a lot of patients ask, Doctor, do you know electroacupuncture? I said, sure. When younger, I love it. Because the electroacupuncture generates more strong stimulation. But it's very simple. It creates a very strong power, blocks the signals. Like if you have a spasm pain, I give electroacupuncture, blocks pain signal to the brain. That means don't cure it.
Dr. Zhao, can I interrupt 1 second?
Yes.
Is the word that you're using electric? Using electricity
right.
with the needles?
Connected pulsation. That's why they call it electroacupuncture. Also, they have many different ways, like a plum blossom needle acupuncture, like little hammer, bead. Also triangle acupuncture. Just all different type, but the same theory, just stimulation, with a physical stimulation to a chemical reactions. That's depending on the doctor, what disease, they choose different type. But it is truly a very effective therapy. The Chinese herbal medicine, that's huge. They have so many herbs. Like normally, I collect more than 700 raw herbs. Each herbs we like formula, we don't like single herbs. Sometimes my patient brought in like a turmeric, good. Take it too long, will burn your stomach. Curcumin, good. But what we use, Chinese medicine from a single herbal ingredient to advance to a formula. In one formula, like herbal formula, at least I have 4 ingredients. What do we say? One is the chief. We call them king. We have 2 assistants. One is the messenger. That's 4 herbs. That's makes the one formula. Not like we put everything together. That's a formula. It's very strictly. We want to achieve what, and then we want to control the side effect. Which meridian, which organ channel we want the medicine goes to. It's all very, very strictly. That's why Chinese herbal medicine is a bigger category. Moxibustion, that's like a burning, like a cigar. We use a moxicon. Yeah, moxicon. It's from the physical heat with the herbal burning this essential oil. Very much like marijuana smells. But the only trouble with this new building drive me crazy. The fire marshal knows me very well. The first few years, when I do that, trigger the alarm. Give you a $25 penalty. So that's, what I do is very useful. Like people, especially for weak people, like they have abdominal cramp, leg cramp a lot. You need a tonic. You need to give them more energy, warm them up. Like the low hypothyroid, always cold. You need the moxibustion therapy. I let them go home to do it. Go to a porch. If you have a husband or boyfriend, let them do it, or reverse. So that's very cupping. Is use a cup. That's what it means. Suck the evil out, right? Use certain point with a vacuum. You have different way to do that. Put on the point. Sometimes we use a little oil before we put the cupping on to prevent, make a blisters. Okay? The skin quality is different. That's why when you use the cupping, I always make sure. Like for the black person, their skin so tender, so fragile. Often you cause a blister. So I make a lot of blister in the beginning. I saw this. I said black skin should be really good. Then I find it really fragile. Really good skin is the white, the Caucasian skin. You don't make a blister for them. So, but still, we use oils. That's a clinically we need to pay attention. The gua sha is also scraping toxin out of this technique. The gua sha, like you have a cold, flu, you use the silver spoons with the gua sha oil put on skin. One directions, follow the meridians. They're very useful. Traditionally, folk medicine they use a lot for like muscle spasm. Which muscle spasm is gua sha. And the Qigong exercise, like meditations, they have many different ways. Like yoga also belongs to Qigong. Tai Chi also Qigong. Basically, they have two categories. One is meditation, static. One is moving. Which way you like, you can do. Okay. The dietary, like I mentioned, for most cancer diet I will recommend is like a microbiome diet, Dr. Jensen diet. So many, I don't like it. You know why? Too strict. Will cause another stress. This I should eat. How much gram I should? How much calories? We don't. That's not enjoy anymore. Eat, have to enjoy, right? Only I told them certain principles. So more variety. No matter what, I can taste first. Okay, small amount. More variety, small amount, and no refined sugar. Okay, not too much greasy food. No fried food. Also be careful. More to remember. No matter what, like what I said, I compare the Chinese cuisine with here the modern American cuisine. Different. We need too less variety. Like I mentioned for the protein. Protein we eat from fish, and fish we so limited. Salmon, tuna, maybe some group very limited. In China there's so much variety. All this crazy different fish. Like we eat pigeon, frog, turtle. They are not natural. They cultivate the turtle. I saw the lagoon, the turtle lagoon, the lagoon. They warm with the water. The turtle can produce so much egg. They use that. That's the best medicine for liver, like the shells. For liver cancer, turtle shell is best. That cannot be replaced. But this is not damaging nature or damaging ecology. That's different. But you can see that any protein you can imagine they have. The pheasants, quails. So because they have so much variety, less side effect. Vegetables here, some Chinese vegetables I never can translate. I go to Tampa, they have a Chinese grocery store, 3 big Chinese grocery stores. We bought a lot of grain every 2 weeks, almost go there. What a vegetable we eat, so similar, so limited, right? And that's why that diet we need the more variety. Don't use much canned food. Sometimes I go to the Publix, I find some of my patients, I follow them. Don't let me find them. I take them the canned food away. Cook a little bit, spend a little time. Good to you, say to yourself, right? Don't, yeah. So Tuina is a specially massage technique. Most Tuina are performed by doctors. You know, they follow the meridian, follow the point. They apply acupressure technique. That's they actually combine the chiropractic technique a lot to do adjustment. That's basically that's the Chinese medicine we do. So now routinely, like for cancer patients, go to me. If during chemo radiation